Welcome to the JCMR JHN Lunch and Learn. My name is Molly Fleming. I'm an RN with Jackson Health Network Clinical Quality. Today's topic is MICR. This is one of a two-part series. I'd like to give a background on MICR. What is MICR? MICR stands for Michigan Care Improvement Registry. It was created in 1998 to collect reliable vaccination information on children. Although it started as pediatric immunizations only, adult IMs were added in 2006. MICR is a lifespan registry for citizens of all ages. MICR is part of the Michigan Public Health Code. In other words, it's law. Many types of agencies use the information in MICR, such as hospitals, doctors' offices, schools, health departments, pharmacies, and licensed child care programs. All should be documented within 72 hours of administration. Document all childhood and adult immunizations. Do we give immunizations? Well, vaccines have greatly reduced or eliminated many infectious diseases that once routinely harmed infants, children, and adults, and even ended in deaths. For the well-being of Jackson community, we provide immunizations. Decrease health care costs, and we have incentive reimbursement around immunizations in programs such as MIPS, meaningful use, programs, the Clinical Improvement Program. We can decrease hospital admissions and readmissions, which ultimately decrease costs. Some recall last year's flu season was a rough one. People had the flu. Many hospitalizations and deaths were related to the flu. We know why we should immunize. Now watch how we document immunizations in EPIC. Off to Lori, hands-on demonstration in EPIC. Thanks, Lori.
Hi, everyone. This is Lori Lewis with JCMR. We do a couple things this afternoon. The first thing we're going to talk about is reconciling immunizations through MICR and Care Everywhere, and we'll talk about the patient to administer an immunization. MICR and Care Everywhere organizations can now be reconciled through the Reconcile Outside Info activity. For activity, IM registry to trigger query. This is in the upper right-hand corner of your. After 10 seconds, click the refresh button that's located next to the IMS registry button. It may take 2 to 3 refreshes during busy times, and on Wednesdays, MICR does weekly maintenance. The MICR will populate under the title of MICR. You will know it's updated by looking at the timestamp. Preferences. A banner will appear at the top of the IM activity. Reconcile. Click immunization name to determine if the IM should be added, updated, or deleted. Keep in mind when reconciling. There are IMs listed in our system that are to immunizations coming in and also have the same date. This may be duplicate. When IM, if there is a dose, manufacturer, lot number listed in EPIC, it will be overwritten by information being accepted from the outside source. Once it's been reconciled, it won't appear again unless there is a change to one of the fields. Is listed in MICR or another organization, but does mention immunization in EPIC, it will show under the new IMS header. If an IM in MICR or another organization matches the name and date of an IM in EPIC, it will show under the Update to Existing IMS header. Verify that there is a dose, make sure a lot number listed, and update necessary. or red be discarded if all of the following are true. Date is in one in our system, and the dose is 0 ml, and the manufacturer is unknown. The lot number is blank. Times where MICR has full information listed for a vaccine that has the same date of a similar but different vaccine that we have listed in our system. This occurred when a date from MICR was previously copied to the incorrect historical vaccine. To correct this, there is data in the incoming M, and there is only a date listed in the M that is in our current system. If so, a new M. This activity, delete the old immunization that's just showing the date. If it's an M in EPIC and in MICR, it should be added to MICR. On M's activity, click the vaccine hyperlink. That's the vaccine and the date, and this will pull the administered M console. In the comment section, MICR reconciliation. Date, there is a route listed, and date that the dosage is correct. So now over to EPIC, and we're going to walk through complete administration of an immunization. Activities on the left. I need more button and immunizations. I'm choosing the immunizations activity. If I'd like to see this, if I open a chart, if I do a lot of immunizations, I can click the star right next to it, and it will always appear on the left-hand side of my activities. So you see incomplete administrations, we have an influenza. Moving to the screen, I'll click the administer button. There stops in here, and you'll fill those in as appropriate. When you did all of the information necessary for the immunization, you will click Accept. You see that this has been presented. You have your dates and you have your pass.